Michelle, thank you. And I'm glad you mentioned this story about the asthma in children in San Francisco. And one of the things that I wanted to underscore is that, and I think you'll see in the next two presentations, storytelling is critical in terms of getting audiences to really sort of tune into your core messages. But the data is also so important here. And I think that it's very important that the journalists marry the two. And for those of you that are trying to get out a lot of these messages, thinking in terms of what's the data that can be provided, the facts, the evidence behind what you're saying, how can you help a journalist translate it, make sense of it, and then humanize it. So without further ado, I want to introduce Kate. Again, you have her full bio. She does co-direct the Try This West Virginia project, which I'm sure she's going to tell us a little bit more about that. And that project actually was sparked by her series in the Charleston Gazette titled The Shape We're In. And I think the fun fact about Kate that I recently learned is that when you mention her name in West Virginia, state lawmakers know it.
They know my name because I'm persistent. We used to have this publisher who was an old-time guy who would run out into the newsroom and yell things like, "Nail the bastards to the wall." Well, he's gone now, but his influence is not. He had a concept called sustained outrage, and usually he applied it to political corruption or other things like that. I decided with my series, with the help of the Annenberg Foundation, without which none of this would have happened, to apply it to our state's high rate of chronic disease and obesity. We're in the top 3 on almost every list there is. And it is a source of great concern and great shame to all West Virginians. We all know this. And how to harness that and turn it into productive action was something that, you know, I have a lot of interest in doing. Now, I'm going to try to stuff 10 pounds of manure in a 5-pound sack here in my 15 minutes, and I'm going to tell you about 2 connected projects. One is an 18-month media project that wasn't supposed to be 18 months, but after we had finished our 6 months, we told people we were stopping, and they said, "No, don't stop. People are starting to talk about this. I can't go to a meeting without people talking about this. We're starting a project. I look for this." And so it ended up going 18 months. And after it was over, I had an opportunity to work with a local community group. My newspaper wanted me to go on to another subject, and I was very engaged in this. And so I switched over to social media and edited a website. So I can talk to you from both perspectives, from inside the media and now trying to get media attention. But we're talking about situations where that are aimed at using media to create policy change, both on the state level and on the local level. We often talk about the state level, but really when you talk about, in my particular instance, of increasing healthy lifestyle behavior, the local level is, I think, pretty much where it's at. You know, you got to engage local people. And so this slide that you see now is the first of 70 stories in The Shape We're In, which ran throughout 2012 and into 2013. And a question was raised earlier, what should the media message be? You got to hit it. You know, people do not, in this case, at the time that I started, we surveyed, and we did not find a lot of people who connected obesity with medical risk. They thought it was an issue of lifestyle, an issue of appearance, and so forth. And so we aimed to change that, because after all, if we had an outbreak of H1N1, everybody would be working together. Everybody would be on the same page. We have to translate obesity into that same level of risk, and at the same time, give people a chance to see it as a way out, to see a way out in physical activity and increasing the consumption of healthy foods. Now, we concentrated on the kids, and I would recommend that for you. I'm going to try to tell you what worked for us and tell you how I would have been helped by the public health establishment. Give us research. Find research, translate it into plain language. I worked with our Prevention Research Center throughout this series, and they did that for me. I did my own research, and they also fed me what they considered to be the best research. I'd tell them what was coming up. They give me good research. I'd weave it into the stories. We were lucky enough to have a cardiac project in our state that actually measures children. They are finding much higher incidence with their actual measurements than CDC does with its phone surveys. When I started, 1 in 4 of our 11-year-olds had high blood pressure and abnormal cholesterol, and 18% of kindergartners were coming to school obese. And this is actual measurements. Our health dollars, our budgets are being totally busted by this, and here's CDC saying that by 2050, if nothing changes, that the incidence and the cost will double. We have no intention of doing nothing. But in order for that to happen, we have to engage the public. And so our goals, well, let me back up here, are to create, we're with the shape we're in, and now with Try This, are to create a statewide conversation. And we need the help of public health entities and people like yourself to do that. We want to keep it going long enough and apply that sustained outrage thing. It's funny, you know, that people say, I wanted to write a story that would change things. We all know there's no one story that will do that. Ned Chilton used to say, sustained outrage means you don't hit it one time. You don't hit it twice. You don't hit it 3 times, 4 times, 5 times. You keep after it until it's part of the statewide conversation. And you also have to generate hope in that process. And so by your stories, you choose stories about people who are making change. Because people want to read about people. They don't want to read about, quote, diabetes. They do want to read about an interesting person who has found a way to quit having to take insulin shots while she has 3 kids and 2 jobs. And so we're going along with this. I'm going to race through this because, like I'm saying, I'm trying to pack it in here. But you want to find, I had a marvelous editor, and the Annenberg weekend was essential in this because it solidified his commitment to this project. You can do this. A lot of times public health people only contact reporters when they have a story. In other words, it's on deadline. Go see them when you don't have a story. Tell them what your concerns are. Tell them how this could translate into the pages of their newspaper or their television, and hold attractive forums like the Annenberg Forum, where you do have them give them little lures, lunch, put them up somewhere, get yourself a grant, do that. Hold them captive in an attractive way, and then let them know what your concerns are. Oh, okay. Everybody ain't gonna read your story, much as you worked hard on it, but they will read the headlines and they'll read the cut lines. And so a lot of times people leave that up to the copy desk, and it's the last thing that gets decided. Make sure that you suggest, and you don't have control over what the media does, but they are looking for good headlines, and if you give them a good one that tells the story, like thousands of West Virginia kids are headed for diabetes, that engages people. So pay attention to that. Supply them with good pictures. Now, the big papers will not run your pictures, but if you tell them where they can get pictures and give them names and phone numbers of people who will supply those, that will be good for them. But smaller papers will run your pictures. And so, you know, we're not just talking. Now you're going to mix the awful news with hope. That is essential. After we ran those the equivalent of terrorist articles for our For our paper, we ran stories like this. We were busting the stereotypes. This is a good old hunter. He got himself off the insulin, lost a lot of weight. You want to give these readers some historical context. West Virginia University helped me with this, but I had to go up there and dig around and find the pictures and so forth. But we came up, hello, this isn't changing. Okay. What happened? That's a reader question. You know it. You got to get to where your readers are. You don't know. Give them archival photos from then and now. You know, we have myths that say people don't read. They don't know history. You know, a lot of people now think, oh, we're just like that. That's how we are. There's no point in trying to change. No, we aren't. I mean, we used to be the poster children for being too thin. Now, all of a sudden, we are the poster children for being obese. How did that happen? You can dig up that research and give it to people in plain English. And as Cece and others were saying, most reporters are busy. They don't have time to do what I did, you know, but if they will, if somebody gives them a plain English material, pictures, names of people, phone numbers that they can call, places they can get, take pictures, events that they can do, they're going to do it. Another piece of advice, concentrate on children. Because in my particular, with my particular subject at least, people tend to blame adults who are overweight, who are obese. They immediately are thinking, well, he should have done this, or it's his own fault, he ate all that. You know, well, children, they don't. Children they're concerned with. Children, it engages their maternal. Everybody has kids. They think about their own kids and other people's kids and what's happening to them. And then you repeat it again and again and again, and spotlight those basic prevention strategies of move more and eat smart. Now, we started with an overview and sort of combined the talking head experts with the actual things that are going on in the community. Here's a bunch of high school kids teaching kindergartners ways to move during the classroom and dance their consonants and vowels. And we have in West Virginia, one thing we do have is a world-class Office of Child Nutrition that is basically leading the nation in terms of retraining cooks to cook from scratch, and also universal breakfast and grab and go, three different ways. We were doing that before it became national policy. And so give them something to be proud of, give them examples. If one of the things that CDC or the Institute and the Institute of Medicine are doing exactly right and I will somewhat disagree with this, what do you call them, one-up reports, weight of the nation, and educating the student body. It's true, people aren't going to watch the whole thing, but they will look at the media reports about them. And the weight of the nation came out just as our legislature was in. We were running this. The timing of things is important during the legislature, and when the weight of the nation piled on to what we were telling them, it pushed over the edge a piece of legislation called Feed to Achieve that has vastly expanded the amount of breakfast being served in West Virginia schools. And the same thing happened this last year with educating the student body. Good timing, Institute of Medicine. It appeared right during the legislative session while we were trying to pass a bill called Move to Improve, the companion for Feed to Achieve. And it didn't go through the legislature because of a political deal, but the state school board passed it. So starting this fall, every West Virginia kid has to have an extra half hour of physical activity per day. And now the question is going to be helping to educate them on how to do that and weave it into the school day. Stories about real people. You're going to choose people who can't be discounted with, yeah, I'd do that if I had their money. And people who bust stereotypes. And you're going to have details about them as interesting people, not just their disease. And here's some examples from my series. This is the women of the Mud River Volunteer Fire Department, and they were 45 minutes from the nearest food store. No track, no gym. All of the very people who were supposed to fail, and they lost 71 pounds average apiece in 6 months by just saying, we got tired of being sick and tired, and social support. It was it. The most powerful thing. They walked together and yacked and laughed in the early morning, and then at night got together at the fire hall and danced to Richard Simmons tapes. Here's a cook in a nursing home. Glenda, beloved woman. So many West Virginians would look at her and say, I know her. You know, that's what you're looking for. She waltzed herself back from the edge of type 2 diabetes. And by the time people learn about Glenda, they want to know how she did that. And mixed it, once again, the mix of the bad news, the awful news with the good news. West Virginia is slammed by sugar. We call type 2 diabetes sugar. And Glenda tells you the way out. Children, this child is on the swim team. She is just a total champion. She is Native American and insulin intolerant, you know, and so she has to work pretty hard, but she was doing great. Religion, here's a lay preacher. And so, you know, you put yourself where your audience is. West Virginia is very religious, and so we want to frame that message also. But I'm saying the same thing in all of these stories. Move more, eat smart. And people read them because they like those people. They're interested in them, and they want to do it. Now, this was on the Outlook page. Sometimes you really, once again, hit it hard. There's a fellow that died before the series came out who was on kidney dialysis. He spoke very movingly and frankly about that. And then another fellow who was a laborer who has no money whatsoever that got together with a diabetes coach and is doing, he's diabetic, but he's doing great now and still is, with the help of people know what's wrong, but you got to tell them how to do it. And you can help with these, finding these people, feeding their names, their phone numbers, the research that backs it up. Most of these stories had a research sidebar that said, research it yourself. How do you know? Here's what happened. If you give it to them, they'll probably run it. Innovative practices, group medical meetings. People can't afford to, you want to mix the social support in with medical checkups. That's a great idea. Hitting it from every angle. Well, we had 70 stories. When I first started, the editor said, you think you can find even 10 stories to hold this? Oh, come on. We could keep finding it forever. There are so many ways into this story. There's so many ways to say the same thing. This, of course, is breastfeeding, and we found out that local hospitals were handing out formula to breastfeeding mothers, and so we packaged that in with a coach. Okay, here's a big one. You, with healthy lifestyles, you get people's attention when you frame it as economic development. Absolutely. This is Williamson, West Virginia, one of the 6 Culture of Health winners, I might say, of the Robert Wood Johnson Foundation this year. I did this 2 years before they got that, and they used it in their application, I think. They were all working together, collaboration all over the stories. These, that's the entire power structure, the mayor, the school board superintendent, the farmer's market woman, the garden club, the lawyer, the nutrition director, all of them working together to make a healthy community in one of the most troubled areas of West Virginia. This says it. We're hopeful. We're moving. People want this so much. And 2 years later, with all this massive publicity from the Institute of Medicine and CDC and our local efforts, we no longer have this problem of people not making the connection between obesity and medical. What we have is a problem with not knowing what to do. Okay, we extended the impact by working with community organizations. Our paper only hits so many people and they don't all read the paper that day. So you set up the project so that it keeps going. We partnered with the WVU Extension Service and made a joint website where they ran our stories statewide with their 55 county reach as they appeared. We also, the West Virginia Association of Counties, decided to, when they started reading the stories, they got in touch with me. They decided to have a Healthy Counties Conference and had us come to it, and also created for the first time a health committee. You know, so a lot of the results that you see are not what you expect. They just sort of come up. So I started systematically contacting people, and before we started, and asked them, will you send your network the URLs of our stories, knowing that when we cover you, we may slam the hell out of you the next time we cover you, but we'd like, this is in our perfect, So that was, we assembled a non-existent list of diabetes counselors, and Medicaid is still using our list. These are the people who agreed to forward our story. I will not run through this list, but you can see it is a substantial statewide targeted reach for this project, and it also created a network. Now, and we created the Prevention Research Center, helped us put together a website that has this entire series on it. If you want to take a look at it in more detail, that's where you can find it. That's set up so it can be a resource for higher education and people who want to assign those to their students. So our legislature asked for study copies. Those two pieces of legislation I mentioned earlier, the statewide after-school network, directly credited the series for their new regulation that students will be active at least half of the time. The partner results, counselors, I love the feedback from the counselors. They told us their clients were coming in and citing this with the latest episode of it became like, I think, a soap opera. And the Try This project, I will very quickly tell you about. This is the project I'm working on now. I am editor of this website, and it's trythiswv.com. It is run by a coalition of statewide partners, many of whom were the very people who sent out the links for the the shape we're in. But you can see the range of what we've got, and we're in talks with outside-the-box groups like tourism, economic development, drug abuse groups, and so forth. We're going to make this a big thing. Could we see the website, and we'll just take a quick look at that. In your materials that have been handed out to you, we don't have time to really look at this. Right now, Try This is a 4-part project. It has a website, which we will look at here in a minute. It has an annual conference. Our first one was this year. We hope to have 150 people. 412 came, and 98 presenters donated their time to be there, and West Virginia Wesleyan College donated its facilities. So people are hungry for this. It's just finding a way to access this. We gave out $82,000 in mini grants to 42 communities. In your materials, I gave you descriptions of those. That lets you know where we are. You've got to take people where they are. These will not meet the research standards that you would like. They are people who are just taking baby steps. We are struggling with them to get them to write goals that have clear outcomes, measurable outcomes. But they are thinking about it. They're getting the concepts, and as we keep going, this is going to be a growing network. Could you? I have to give. Okay, we're going to run your the pointer over some of these you can see this is how you use the website, and just a few more go over. And this is the CDC laundry list, basically, of steps that communities can take to create healthy options on the local level. Now, go back up to that community garden one there. You see that one? Over. There you go. Click. And just to show you, click on that, and to show you now, scroll down. It starts, all these pictures are taken in West Virginia, and it starts with a little local story. Sometimes you want to start and expand your community gardens. Sometimes there's a video, but there's links to national and state websites that will tell you how you can do that. Learn about community gardening from other West Virginia communities. Oh, okay. Well, I need to quit on this then. We will show you a 3-minute video from this as you go to lunch, and thank you so much. And